The grand ballroom of the Fairmont Hotel in Seattle was a symphony of success, a carefully orchestrated performance of opulence and self-congratulation. Crystal chandeliers, each one the size of a small car, dripped light onto the sea of perfectly tailored tuxedos and glittering evening gowns. The air, thick with the scent of expensive perfume and triumph, buzzed with the murmur of Seattle's elite, investors with predatory smiles, board members puffed up with importance, and a flock of journalists scribbling furiously in their notepads, eager to document what they believed was a triumph of modern medicine. Champagne glasses clinked like 1,000 tiny bells, a constant, cheerful sound that grated on my nerves like nails on a chalkboard. From my solitary table in the dimmest corner of the room, I watched the man at the center of it all, Bradley Kerr. He stood on the brightly lit stage, his voice, amplified by the state-of-the-art sound system, echoing through the cavernous space. "This success proves we made the right choice," he declared, his arms spread wide as if to embrace the adoration of the crowd, firing the incompetent staff who would have held us back. The audience erupted in applause. They were applauding my dismissal. They were celebrating the very act that had shattered my life, applauding the man who had built his glorious stage on a foundation of lies, deceit, and my professional corpse. I felt a cold, hard knot tighten in my stomach. In my lap, my fingers tightened around the cool, metallic handle of the silver briefcase. It felt impossibly heavy, weighted not just by the documents and recordings inside, but by 11 years of my life. 11 years of meticulous work, of unwavering dedication, all culminating in this one final act of compliance. My name is Helena Briggs, and I am 49 years old. For what felt like a lifetime but was in fact 11 years, I had been the backbone of regulatory compliance at Graythorne Analytics. My job, my entire professional identity, was built on a simple, unwavering principle: integrity. I was the gatekeeper, the final line of defense, ensuring that every clinical trial, every safety report, and every single submission to the Food and Drug Administration met the strictest, most unforgiving standards. I was the woman who caught errors before they became disasters, the one who questioned data that seemed too perfect, who insisted on triple-checking every decimal point because I knew that behind those numbers were real people, real lives hanging in the balance. I made sure our company operated with an integrity that was as solid and unshakable as the science we were supposed to be championing. But integrity, I learned the hard way, was not a quality Bradley Kerr valued. Not when it stood in the way of his ambition. He had arrived 8 months ago, a whirlwind of charisma and Armani suits. The company, founded 25 years ago by the brilliant and deeply ethical Dr. Elizabeth Graythorne, had always been a family-oriented place. Dr. Graythorne's mission was to develop safe, effective treatments for rare diseases, the ones bigger pharmaceutical companies ignored because the profit margins were too small. We were a powerhouse of innovation, but we moved with caution and a profound sense of responsibility. We took our time. We were thorough. Our work saved lives, and we never, ever forgot that. When Dr. Graythorne retired, she handpicked Bradley to be her successor based on his impressive track record at larger pharmaceutical companies. "He has the vision to take us to the next level, Helena," she had told me, her eyes sparkling with hope. "He'll bring in the investment we need to expand our research, to help even more people." I remember our first all-staff meeting with Bradley. He stood at the head of our modest conference room, his presence immediately commanding attention. His dark hair was perfectly styled, his suit tailored to perfection, and his smile radiated the kind of blinding confidence that made investors write enormous checks without a second thought. "We're going to revolutionize this industry," he announced, his eyes, the color of polished steel, sweeping across the room. "The old ways of doing business are too slow, too cautious. We need to move faster, think bigger, and take calculated risks. That is how we will truly make a difference." At first, his energy was infectious. A jolt of electricity ran through the company. The entire team seemed energized by his vision of rapid growth and market expansion. Our laboratories, once quiet places of methodical research, began to buzz with new projects and an accelerated sense of urgency. Funding, just as Dr. Graythorne had predicted, flowed in from investors eager to be part of what Bradley called the next pharmaceutical breakthrough. Even I, a creature of caution and protocol, found myself caught up in the wave of cautious optimism. The project that consumed us all was Novacure, a revolutionary treatment for a range of debilitating autoimmune disorders. If it worked, it would change millions of lives. The initial science was sound, and the potential was breathtaking. I was proud to be a part of it. But as the weeks turned into months, my optimism began to curdle into a persistent, gnawing unease. The pressure from Bradley to accelerate the Novacure trials was immense. Timelines were compressed, protocols were streamlined, and a new, slick vice president of clinical development, Marcus Webb, was brought in to oversee the process. Marcus was a Bradley loyalist, a man who treated me like an antiquated relic from a bygone era of pharmaceutical development. He was all swagger and dismissive smiles, a perfect sycophant to Bradley's messianic CEO. The first red flag appeared in a preliminary dataset. The patient response rates were perfect, unusually, impossibly high. The reported side effects were so minimal as to be statistically insignificant. In my 11 years, I had never seen a clinical trial produce such flawlessly positive results. Science is messy. The human body is unpredictable. There are always outliers, always unexpected reactions. Data this clean wasn't just good. It was suspicious. I started my own quiet audit, working late into the night, my office the only one lit on the 4th floor. I pulled the raw data logs, cross-referencing patient identification numbers with the submitted reports. It was like pulling at a single loose thread that unravels an entire tapestry. I found discrepancies. A patient who had experienced severe liver failure was mysteriously absent from the official safety report. Another, who had been hospitalized due to an extreme allergic reaction, had their entire record scrubbed. Timelines were fudged, adverse events were recategorized as unrelated pre-existing conditions, and entire datasets appeared to have been massaged to fit a perfect narrative of success. The deeper I dug, the more horrified I became. This wasn't just cutting corners. This was a deliberate, systematic effort to deceive. I felt a cold dread creep over me. This was the kind of corporate malfeasance I had dedicated my life to preventing. Armed with a folder thick with printouts and highlighted inconsistencies, I requested a meeting with Bradley and Marcus. I laid out my findings on the polished mahogany of the executive conference table, my voice steady despite the tremor in my hands. There are serious issues with the Novacure trial data, Bradley, I began. I cannot, in good conscience, sign off on these submissions to the FDA. Bradley listened with a mask of polite concern, his fingers steepled under his chin. Marcus, however, couldn't hide his sneer. He rolled his eyes, a gesture of such blatant disrespect it stole my breath. Bradley let the silence stretch for a moment before speaking, his voice smooth as silk. "Helena," he said, his tone dripping with condescension, "I appreciate your attention to detail. Truly, it's one of your greatest strengths. But we can't let perfectionism become the enemy of progress. These results aren't suspicious, they're exceptional. Sometimes, breakthrough treatments produce breakthrough results." "This isn't about perfectionism," I retorted, my voice rising. "This is about patient safety. This is about scientific fraud." His smile was a thin, cruel line. "I think you're overreacting. Perhaps you're not accustomed to the pace of a truly innovative company. Marcus, what are your thoughts?" Marcus Webb leaned forward. "Helena, with all due respect, you're seeing ghosts. We've had our best people on this. The data is solid. We're on the cusp of helping millions. Are you really going to be the one to stand in the way of that over a few statistical anomalies?" The meeting was over before it began. My concerns were dismissed, my expertise invalidated. A week later, I was called into HR. My position, I was told, was being eliminated as part of a necessary corporate restructuring. It was a clean, brutal, and utterly predictable execution. I was escorted from the building with a box of my personal belongings, my 11 years of service reduced to a severance package, and a non-disclosure agreement they expected me to sign. The first few weeks were a blur of shock and rage. The man who had destroyed my career was being hailed as a visionary. I sat in my small apartment overlooking Elliott Bay, the Seattle skyline twinkling in the distance, and felt nothing but darkness closing in. The world I had dedicated my life to, a world of rules and ethics, had been turned upside down by a man who respected neither. But my anger soon gave way to a cold, hard resolve. I couldn't let him get away with it. I thought about my father. He had died years ago from complications related to an experimental cancer treatment, a drug that had been rushed to market without proper safety protocols. I remembered holding his frail hand in the hospital, watching him suffer through side effects that could have been prevented if anyone, had been willing to speak truth to power. I had become a compliance officer to honor his memory, to ensure that no other family would endure what we had. Then a lifeline. An unexpected phone call from Jennifer Rodriguez, a former colleague who had also been restructured out of her position shortly after me. She was terrified but furious. "Helena, I couldn't stay silent anymore," she whispered over the phone. We met at a quiet coffee shop in the Capitol Hill neighborhood, far from the prying eyes of the corporate offices where we had once worked side by side. "After they fired you, things got worse." "Much worse," she said, sliding a manila envelope across the small wooden table. Inside were photocopies of internal memos that made my blood run cold. They revealed a systematic effort to manipulate clinical trial data, hide adverse patient reactions, and forge compliance certificates that had been submitted to federal regulators. "They made us rerun tests until we got the results they wanted," Patricia Chun, a young lab technician Jennifer had brought with her, explained, her voice heavy with guilt. "When patient 247 died from liver failure during the trial, Marcus Webb told us to reclassify the death as unrelated to the medication. He said the patient had a pre-existing condition that we hadn't detected." The most damning evidence was on a small flash drive Jennifer passed to me. It contained a treasure trove: original laboratory reports showing severe adverse reactions, internal emails discussing data manipulation strategies, and even video recordings of meetings where Bradley and Marcus explicitly discussed falsifying safety data. In one particularly damning recording, Bradley was captured saying, "The FDA reviewers won't know what they're looking at if we present the data correctly. We just need to highlight the positives and bury the negatives in statistical noise." It was all there, a complete, irrefutable picture of fraud. I knew what I had to do. Through a mutual friend who worked in federal law enforcement, I arranged a secure meeting with Agent Sarah Kellner at the FBI's Seattle field office. She was a seasoned investigator with extensive experience in pharmaceutical fraud cases. After reviewing just a portion of my evidence, she confirmed what I had suspected. "Graythorn Analytics is engaged in multiple federal crimes," she said, her expression grim, "including fraud against regulatory agencies, endangering public health, and securities violations. Mr. Kerr and his associates are looking at serious prison time if we can prove these allegations in court." She paused, looking me directly in the eye. "But we need to be strategic about how we proceed. If they suspect they're under investigation, they might destroy evidence or flee the jurisdiction." We agreed that the Novacure launch party would provide the perfect opportunity. It was a high-profile event, a public spectacle where Bradley and his inner circle would be cornered, basking in their fraudulent glory. It was the perfect stage for their downfall. The weeks leading up to the party were a strange mixture of anticipation and dread. I transformed from a displaced compliance officer into something resembling an undercover investigator. I used my 11 years of industry contacts and my intimate knowledge of Graythorn's internal systems to systematically document every aspect of Bradley's fraudulent operation, feeding information to Agent Kellner. My investigation revealed another disturbing pattern. Bradley had systematically removed or silenced anyone who might pose a threat to his scheme. Besides Jennifer and myself, 5 other long-term employees had been terminated or reassigned to positions where they would have no access to clinical data. The message was clear: question the approved narrative, and face professional destruction. The night before the launch party, I sat in my apartment assembling the final components of what I had come to think of as my insurance policy. The silver briefcase, the one now sitting in my lap at the party, had been my grandfather's. It was a silver-plated piece he had carried during his years as a government accountant. Tonight, it would carry the truth that Bradley had tried so desperately to bury. Inside the briefcase, I had organized the evidence into 3 distinct categories. The first section contained documented proof of falsified clinical trial data, including before and after versions of safety reports. The second held the audio and video recordings. The third section was perhaps the most devastating: financial records showing how Bradley had manipulated research costs to justify higher investor contributions while simultaneously understating potential liability issues in corporate financial reports. I reflected on how dramatically my life had changed since Bradley's arrival at Graythorne. 8 months ago, I had been a respected compliance officer with a secure career and a clear sense of purpose. Tonight, I was a whistleblower, preparing to destroy the company that had once been my professional home, knowing that my actions would likely end any possibility of me working in the pharmaceutical industry again. But I also knew that staying silent was not an option. And so here I was. The Fairmont Hotel's ballroom was a symphony of success when I arrived at exactly 8 p.m. Bradley stood at the center of it all, resplendent in a perfectly tailored black tuxedo, his smile radiant as he shook hands with investors and posed for pictures with prominent medical researchers. A large banner reading, "Novacure, the future of autoimmune treatment," hung behind the stage where he would soon deliver his victory speech. I moved through the crowd slowly, my silver briefcase drawing curious glances from guests who recognized me despite my recent termination. Several former colleagues approached with awkward small talk, clearly uncomfortable about my presence, but unsure how to address the elephant in the room. I smiled politely and made appropriate responses, all while keeping my attention focused on Bradley's position and the federal agents I knew were positioned throughout the venue, disguised as catering staff, security personnel, and even journalists. When Bradley finally took the stage at 9:15 p.m., the room fell silent with anticipation. The lighting dimmed, except for a single spotlight that illuminated him like a theatrical star preparing to deliver the performance of his lifetime. He began with gracious acknowledgments of investors and staff members, his voice carrying the confident tone of a man who believed he had successfully deceived everyone who mattered. "Tonight marks the culmination of years of dedicated research and development," he announced, his eyes sweeping across the audience with practiced authority. "Novacure represents everything we stand for at Graythorne Analytics: scientific excellence, regulatory integrity, and an unwavering commitment to patient safety." The irony of his words was almost unbearable as I prepared to stand and make my final contribution to Graythorne Analytics' legacy. "This success proves we made the right choice firing the incompetent staff," he continued, his voice rising with triumphant authority as the audience erupted in enthusiastic applause. His eyes found mine in the back of the room, and his smile widened with unmistakable malice. "To those who understand that progress requires bold leadership, not the timid voices of the past who would rather see innovation stifled by excessive caution." The crowd cheered again, completely unaware that they were applauding the dismissal of the very person who had tried to protect them from pharmaceutical fraud. Bradley raised his champagne glass higher, his expression radiating the satisfaction of someone who believed he had eliminated all threats to his elaborate deception. That was my moment. I stood slowly, my silver briefcase gleaming under the ballroom's elegant lighting. As conversations gradually died and heads turned in my direction, the room's energy shifted palpably. Guests recognized the woman who had been publicly humiliated and professionally destroyed by the man they were celebrating. Bradley's expression changed from triumph to confusion, to something approaching fear, as I began walking deliberately toward the stage. "Ladies and gentlemen," I announced, my voice carrying clearly through the suddenly silent ballroom, "I have one final contribution to make to Graythorne Analytics." The crowd parted before me like water, their faces reflecting a mixture of curiosity and uncomfortable anticipation. Bradley remained frozen at the podium, his champagne glass suspended halfway to his lips, as I climbed the steps to the stage with measured precision. Standing directly in front of him, I held out the briefcase that contained 11 years of pharmaceutical compliance expertise and 4 months of painstaking investigation. "Here's my final contribution," I said calmly, my words echoing through the microphone system that had, moments before, been amplifying his fraudulent victory speech. Bradley's hand trembled slightly as he accepted the briefcase, his eyes searching mine for some indication of what was about to unfold. But I simply turned and walked away, my heels clicking against the marble floor as I headed toward the ballroom's exit, knowing that federal agents were already moving into position. Behind me, I could hear the confused murmur of voices as Bradley tried to regain control of his celebration, unaware that his world was about to collapse with devastating finality. Just as I reached the grand, ornate doors, Agent Kellner's voice cut through the room, sharp and authoritative. "Bradley Kerr, you are under arrest for fraud, conspiracy, and endangering public health." Chaos erupted. The clinking of champagne glasses was replaced by gasps of shock and the frantic clicking of camera shutters. I didn't look back. I stepped out into the cool Seattle night air, the weight of the last 8 months finally lifting from my shoulders. I realized then that revenge had never been my true motivation. It had always been about protecting the patients, the ones who trusted that someone somewhere was ensuring their medications were safe. In bringing down Bradley's empire of deception, I had reclaimed not just my professional integrity, but my father's memory and my own sense of purpose in a world where doing the right thing often comes at the highest personal cost.